I'd like to introduce Dan Karant, owner and pharmacist of the Medicine Shop in Norton, Ohio in the US. Thank you for joining me, Dan.
Sure. hmm
Could you tell me when you first heard about LDM?
Oh gosh. I honestly am not sure I could. This would be better than probably 10, 15 years ago, maybe longer. I can't remember.
Hmm.
I know that we had a number of different indications that we suspected at the time would evolve, and we are currently using it for a number of different indications. So I really honestly, I've just been working in this field for 22 years. I'm really not sure when we began doing it.
Well, that's okay. So, what conditions do your patients take LDN for?
Well, the most obvious are going to be fibromyalgia. I probably have over 100 fibromyalgia patients coming to my practice. Not a lot of them on LDN. They're on a myriad of different things, but
Hmm.
that's a significant portion, including my wife.
Oh, right.
We also have a physician locally who has fibromyalgia. He has. And so it's a little bit less common in males than in females. So having one of the most world-renowned physicians in fibromyalgia here in our area is a real plus. And
Hmm.
so he does send us some patients on this. Also, Crohn's disease, irritable bowel syndrome, multiple sclerosis. We just started a new patient on MS this past week. Um, those are probably the most common.
And what kind of success rate have these people had?
I'd say varied. I really don't know that I can say more than 50%.
Hmm.
And whether it's a matter of education or selecting the right patient, I'm really not sure because a lot of this stuff is beyond our control once they leave with their precious prescription.
Yes.
So whether the doctor really had a good candidate for it or not, I doubt that they're checking the eosinophil sed rate, but that can be a predictor of fibromyalgia success.
Hmm.
And if we have a baseline erythrocyte sed rate, we can get an idea in probably 80% of the patients of how effective it will be in that group.
Right. Has anybody reported any unusual side effects?
I have an occasional patient, but honestly, I'd say that's probably not the norm. If I have a patient that drops away, it's usually because they don't feel it's working.
Hmm.
As far as side effects, I'm kind of thinking that if I had given certain patients a glass of water and told them it had a drug in it, they would have a side effect. I believe it's that group.
Right.
It's very rare to have a side effect on this.
So, how many patients do you think you might have on LDN at the moment?
Oh, right now I'm not really sure. I could do a report, probably would take me a while to tell you because I have several strengths that I make. I would guess at any given time I have less than a dozen, uh, you know, getting a monthly prescription or a 3-month prescription.
Hmm.
But over the years I've had quite a few.
And how do you compound your LDM?
Well, I guess what you're asking me is it going to be in a sustained release or immediate release capsule? And it always should be immediate release for best
Hmm.
absorption. It has to hit the colon at a certain point of time, and you don't want it to be delayed, and you want it to be full strength. So you really don't want to do anything other than immediate release.
And do you compound in capsules, liquid, cream?
I would say entirely capsules. I'm trying to think of some other, and I don't recall any other dosage form than a capsule. And certainly not a sustained release. It's immediate release capsules.
Hmm. And what would you say to a patient who was contemplating trying LDN, but rather skeptical if they asked for your advice?
Well, it's funny, but I have one of those patients I spoke to yesterday. And what I said was, how are you doing with your current therapy? Trying to remember now what, gosh, I think she was an MS patient, I think. She was new to me and referred to me.
Mm-hmm.
And no, her doctor is the one I just was mentioning, Dr. Pellegrino. She is definitely a fibromyalgia patient. And my questions for her were what is your fear about this? And it's generally from reading things on the internet that tell of the side effects of the naltrexone at 50 milligrams, which can be very self-limiting because there's unpleasant things that will happen at that full 50 milligram strength. But we're using less than a tenth of that. For them to understand that they're only getting less than 10% of the manufactured product that they're reading about on the internet, that solves a lot of problems right there. We don't have to go much further generally. But since they also want to know what types of side effects, it would be very minimal things that they would expect. But if they have a problem, they're to report it immediately. And that I've probably had less than 1 or 2% of my patients report side effects. That, again, gives them a pretty good security that, well, there's not been a history of a lot of problems.
Mm-hmm. What else could you add from your experience of dispensing LDN?
Well, one of the problems that I've had over the years has been more in the physician realm, where a physician may want to do something that's really coloring outside the box and maybe start the patient on a half or 1 milligram and build it up weekly to a dose of maybe 25 milligrams. And that really circumvents the whole reason for using LDN. But they start out at such a low figure. Mm-hmm. Patient doesn't have really good insurance. They're probably not going to follow it through all the way to this taper up, and then where they start getting side effects with the maybe 12.5 or the 25 milligram dose. You really want to keep it somewhere around 1, 3, or 4.5 milligram to really be LDN. Mm. So it's really familiarity with dosing protocols that the doctors sometimes fail. And because of that, the patients will fail.
Well, it's sad, isn't it?
It is, yes.
Well, thank you very much, Dan, for sharing your experience with us.
Sure, you're welcome. Hopefully they'll do somebody.